Hi, I'm Dr. Rasya Dixit. The most common epidemic which is now going through all the women today is the epidemic of PCOS or polycystic ovarian syndrome. In this syndrome, because of the increased amount of sedentary lifestyle, increased stress, delayed sleep habits, as well as lot of hormonal changes, weight gain, lack of exercise, eating the wrong kind of food, a lot of women in the fertile age group are experiencing polycystic ovarian syndrome. This may manifest as irregular periods, as obesity, as facial pigmentation, as neck and underarm pigmentation, as hirsutism or facial hair growth, definitely as acne. And this acne, which is associated with PCOD, is usually large, cystic, deep-seated and tends to recur mostly around the period times in the jawline area and may extend to the cheeks and as well as the neck areas. And because PCOS associated acne is long lasting, it keeps recurring because of the PCOS, it tends to leave a lot of pigmentation and it's associated with a lot of scarring, again causing a lot of embarrassment for the people who have this condition. How do we treat PCOS associated acne? We have to understand that the triggers of the PCOS are the triggers of the PCOS associated acne as well. What are the triggers? This could be an increased stress, lack of exercising, eating high glycemic index foods. When I say high glycemic index food, it need not mean only desserts, but even processed foods like pizzas, like puffs. These things could also be adding to the increase in the glycemic index, which triggers the acne. Eating too much dairy products, paneer, cheese, milk, and definitely sugar is there on that list as well. And lack of sleep, not having a proper sleep routine. Lack of exercise, not having enough physical activity. All these things are going to trigger the PCOS induced acne. How do we treat the PCOS associated acne? You have to understand that there are two conditions here. We have to treat the acne and we have to treat the PCOS. Like I told you, the treatment of PCOS is basically exercise, avoiding the junk food and making sure that you're getting enough sleep and dealing with the stress by doing exercises like pranayama, breathing exercises to bring down the cortisol levels in the body. And in addition to that, some women may actually need hormonal treatment as well. In the dermatologist point of view, the acne has to be treated. It may not respond only to the topical creams because this is more deep-seated. So, because we have to address the cyst, we may have to give a prescription of oral antibiotics like tetracyclines. We may have to add on metformin, which will help to control the sugars. We may have to add on oral contraceptive pills or vitamins which work with PCOS like myoinositol, like alpha-lipoic acid, in combination with oral isotretinoin to make sure that the acne recurrence is stopped. Often, the treatment of acne and acne scars is also complemented by the use of chemical peels to address the issue from the surface area and carbon laser treatments to address the scars. Now, a multidisciplinary treatment approach is best for patients with PCOS. They may need a dermatologist's advice for the management of acne. They might need an endocrinologist to help them with the hormonal conditions. They may need a gynecologist's advice to manage their periods. They may need a nutritionist as well to help them to manage the weight. And definitely somebody who helps them, like a fitness instructor, to help them to motivate them to lose weight. Unfortunately, this is a long-term condition. It needs long-term commitment to treatment. So if you are suffering from PCOS and you have severe resistant acne, remember that this acne could leave long-term scars on your face. So it needs to be treated early and it needs to be treated aggressively so that your skin does not get any scars. Speak to your dermatologist early.